Hi, everyone. Welcome to the Empowered Mama Summit. I'm Dr. Ksenia Gershberg, and I'm super excited to be here today with Dr. Elizabeth Berg. She is a mom, a wife, and wellness practitioner passionate about preconception health and nourishing moms and babies through perinatal health and lactation support in New Brighton, Minnesota. When she's not in the office, she's with her kids in the garden making mud pies or in the kitchen making paleo chicken pot pie. Welcome, Dr. Berg. I'm so excited to have you.
Thank you so much, Ksenia. I so appreciate you having me on today.
Today, we're going to be covering an interesting topic called Best Breastfeeding Begins Before Baby. So can you please tell us, what do couples who are planning need to be aware of?
Yes, I think it's really important that couples understand that breastfeeding or preparing for breastfeeding begins even before conception. And we all know it takes two to tango. So I think that's important not only when it comes to conceiving a baby, but also in the health of a baby and the health of the ability of a baby in order to breastfeed. So some interesting research shows that a baby who maybe has fetal alcohol syndrome, it can be tied back to dad. We know that if a dad consumes a lot of alcohol for the 4 months prior to conception, that baby is more likely to suffer from fetal alcohol syndrome. So I think this really shows us a great example that dad's nutrition and the food or the building blocks that he consumes really plays a part in how healthy a baby can be, as well as mom. Her milk ducts were beginning to form when she was in utero inside of her own mom. So her own mom's nutrition really impacted her health, as well as during puberty, during that time when mom's milk duct glands are really starting to come to full maturation or come to full completion. We're seeing that her health during her puberty time really impacts her ability to make milk for her baby, as well as then her health during pregnancy affects baby's ability to be able to breastfeed. We know that a mom, if she's getting adequate folate, will have a lot less risk of midline defects and a lot less risk of things like tongue and lip ties, which can highly impact baby's ability to breastfeed. So we really want to focus on breastfeeding well before breastfeeding starts, and that begins prior to conception.
It's so interesting because I feel like a lot of us don't even know that, right? That's the big journey that it ties all the way back to when we were in utero in our mom. So interesting. How can birth actually influence breastfeeding?
Yeah, birth highly impacts breastfeeding in the way we birth and in the way we prepare for birth. We know that if a baby has a less stressful birth experience, they're going to have better outcomes breastfeeding. We know, especially as it relates to Pitocin and any type of intravenous fluids. So we know that a mom who maybe has some IV fluids during her labor, she will be more likely to have what we call a false engorgement. She's got extra swelling from all that extra fluid in her body. So it's going to be harder for a baby to be able to latch postpartum after baby's born. So if we can minimize and avoid any type of epidural or intravenous fluids, we're going to see a much better breastfeeding outcome. We also know that with Pitocin too. Pitocin, which is our synthetic oxytocin, tends to inhibit the mom's or delay lactogenesis. So we're going to see mom's milk supply not coming in as soon as it would if she had more of a natural birth experience. So we really want to focus on things that are going to help mom have a natural birth experience so that she can have ideal breastfeeding outcomes.
And with my first and second, I could completely tell the difference. Like I had with my first, I had that Pitocin, and then with my second, I had all natural, and the breastfeeding was completely different. So I completely agree with all of that. It's incredible.
Yes, moms know it and they've seen it. And I always joke, birth itself, labor itself, usually lasts for upwards of 24 hours max. Most moms don't go over 24 hours. Some do, but the average, let's just say 24 hours. But breastfeeding, most moms hope to breastfeed for much longer than 24 hours. And in our society, we put all of the emphasis on learning and preparing for birth, which lasts a very short amount of time. So I just really advocate that. I want more couples to start putting more emphasis on learning more about how are we going to do this breastfeeding thing? What are things we can do to make breastfeeding occur more easily? Because most couples do plan and hope that their baby can be breastfed for longer than 24 hours. In America, especially, I find a lot more parents wanting to breastfeed for 6 months, up to a year, or even longer, which is awesome. That's how nature intended it.
So how do you think these families can limit these interventions during birth?
Yeah, limiting interventions during birth means that we need an ideal birth experience. So the easier way for a passage. So it's in the birth community, I talk about the passengers, the baby, and then the passageway, which makes up mom's pelvis. So we really want to optimize mom's pelvic alignment. So one of my favorite things, of course, being a chiropractor, is chiropractic care. We know that if the pelvis is in good alignment and the ligaments are in proper alignment and they're in proper tone, we're going to have a pelvis that can open more easily for baby to be able to pass through that birth canal. We also know that other body work can be really helpful too, and just prenatal exercise. In societies where women do a lot more squatting versus sitting in chairs all day, they have easier birth experiences. So I think we need to focus in our daily activities and how we're supporting our muscles and our ligaments in order to have a better birth experience. I think one of the other integral things is our support during birth. And that's where I love doula supports and just midwives in general, who offer a lot more support for that birth experience if we're having families who need that support to get through. And a lot of couples say, well, I'm going to have my spouse there for me. I'm going to have my partner and they'll help me get through labor. And I always encourage them to examine, has your partner seen birth before? Because if they haven't seen birth before, they may not be as good of a support for the birth process. So if we can have some support for that birth process from a doula who's seen birth hundreds of times, versus a spouse who might be there for the partner, and having a doula who's there for the birth aspect, because they know birth and the spouse knows their partner best.
I love that. I'm a huge advocate for a doula, and I feel that even like in second births, you should have a doula. I've had a doula both times, and I think it's life-changing. I definitely agree with that.
Yes, even just to give, from my personal experience, to give my husband a break. He was working hard, doing hip squeezes, doing
Yes.
things that would help open my pelvis to allow baby to descend and have a easier passageway. He was working hard, and at some point he needed a break to go up and use to be able to support me was key, so that he could have a break and both of our bodies could recover, so we could take care of baby afterwards more easily.
Definitely. And going along with the preconception care and making sure that parents are healthy before they conceive, we are seeing a lot of families have excuse me, have babies born with lip and tongue ties. What do you suggest that moms take as necessary steps to assist with still being able to breastfeed?
Yes, I think the tongue and lip tie issue, again, we need to be preventing that is the best key in addressing that with preconception care, proper nutrition and proper health prior to conception. And that's going to be at least 4 to 5 months prior to conception. So getting proper care then. But what if we have a baby who is born with a tongue and lip tie? What can we do to make sure that breastfeeding can still occur, so we're not throwing in the towel and saying this doesn't work? I think there's a lot we can do, and that comes down to, again, a lot of good support. I think we can ensure that the tongue can maximize its function as well as possible through doing some home strength training, suck retraining exercises, and that's something that I have as a resource available for clients in my office and for other other families out there who might be interested, through my website, nourishfamilywellness.com. We have a tongue and lip tie resource where we demonstrate those suck retraining exercises and some home craniosacral exercises too, so you can be helping support the structures that attach to the tongue so that the tongue can move in its most efficient pattern. Now, these are all just kind of crutch type things that help the tongue function as well as possible, but they don't correct the problem itself. And that problem is indeed a restricted tongue frenulum that we know only is about 3 to 4% elastic. So that does require a small intervention. And I get a lot of kickback from families of, well, maybe I should just give up breastfeeding and not cause any distress or put my baby through any trauma by having to do that procedure. And I always like to take it from a different perspective and analyze it and say, well, we see babies who are born with webbed fingers. They often will have a surgical procedure to remove that webbing between their fingers, and that allows the fingers to function fully throughout the life of the individual. It doesn't even help with breastfeeding. So that's where I think it can be very important to go ahead and release that excess tongue frenulum tissue so that we can have an ideal breastfeeding outcome and improve tongue function, not just for breastfeeding, but for all of the functions of the tongue as baby grows older, whether that be for speech, whether that be for the way the tongue shapes the palate and makes more room in the mouth for all of the teeth, so to prevent future orthodontic work and wisdom teeth removal, whether it be for breathing to prevent sleep apnea and some of those other bigger things that we see as commonplace in adults that we maybe didn't know were related to tongue function. So I have certain providers in my area that I love referring back and forth with, because I know that they are going to be supporting the tongue after the release procedure. The tongue being a muscle, it needs some rehab. It can't simply just have a procedure and then function well. I kind of relate this to knee replacement surgery. Nowadays, we see with knee replacement surgery, the best outcomes coming with individuals who have prehab beforehand, and then they have the actual procedure. And now things aren't solved just because we have the procedure. We have to do some rehab afterwards to ensure the musculature and the muscles function at their best so that leg can function at its best. Similarly with the tongue, if we can strengthen the tongue and ensure the body is supported with chiropractic care and with the suck retraining exercises, and maybe some additional body work like craniosacral therapy before and after the tongue release procedure, we're going to see the best outcomes. Often with infants who are breastfeeding, it includes a lactation consultant too. So it really takes a team to ensure these infants are supported and they can have the best breastfeeding outcomes possible. Sometimes we have to take just a small hiatus maybe from breastfeeding and do some finger feeding, but still maintaining a skin-to-skin touch form of feeding really helps preserve that breastfeeding relationship and allows us to get back to breastfeeding fairly quickly. Usually in my office, we have within a week after the tongue release procedure, we have mom back to breastfeeding. So I think that is just ideal when we can have mom supported with proper care and have baby supported with proper care. And I'm passionate about that. I actually do training for other chiropractors too, so that they understand the craniosacral exercises and the home suck retraining exercises so they can support moms. So if anyone has questions and they're not close by to me, I'm happy to refer them to a provider who's gone through the training I offer so that they understand and can help support their baby at their best.
Definitely, I think it's so important to make sure that we're looking at the issue as a whole and have that whole support team to support mom and baby. And your programs are truly amazing. I hope that everybody who is having these kind of like lip and tongue tie issues goes out and checks out Nourish Professional and Nourish Wellness. And I will be posting the websites and the links. So thank you so much for being on here and taking your time to have these resources for moms.
It is my pleasure. I'm so glad that parents can have the knowledge that I didn't have going into life with babies, hopefully to plan and prepare and really have the ideal breastfeeding, the outcome that they would like with all of this information. Thank you for putting this together. Moms are so lucky to have all of this information. Thank you, Ksenia.
Thank you.
Yeah.